Hello, the Illinois Comprehensive Cancer Control Program is pleased to present this overview of the 2022 through 2027 Illinois Comprehensive Cancer Control Plan. Here is our vision and mission statement, which guides all of our programs and activities. The 2022 through 2027 Illinois Comprehensive Cancer Control Plan is available to view and download on the IDPH website at the link shown here. The plan provides a roadmap to guide cancer prevention, screening, treatment, and survivorship activities throughout Illinois. The plan is intended to mobilize stakeholders and partners through prevention and control efforts. Execution of the plan will require a collective effort by stakeholders and partners. The plan was developed by the Illinois Cancer Partnership and its Cancer Plan work groups. We are extremely grateful for everyone who shared their expertise in the development of the plan. The plan is based upon the three priority areas of prevention, screening, and early detection, and diagnosis, treatment, and survivorship. Health equity is embedded within each priority area. We have an enhanced section in this plan focused on community engagement to ensure we included the voices of those affected by cancer, their caregivers, and the community. Quotes from people impacted by cancer are interspersed throughout the document. Throughout the plan, we will identify the corresponding page numbers from the cancer plan. Each priority area has goals, objectives, and strategies identified. Goal statements set the fundamental long-range direction. Objectives break down the goal into smaller parts that provide specific, measurable, attainable, realistic, and timely actions by which the goal can be accomplished. Data sources used for the objectives in the plan are listed in parentheses after each objective and are publicly available so anyone can track progress towards meeting these objectives. Strategies are specific actions that can be taken to help achieve the objective. The strategies are divided into different focus areas of policy, health systems, environmental changes, and health equity. Policy strategies are tools for achieving health promotion and disease prevention program goals. Policy decisions are made by organizations, agencies, and stakeholders and include legislative advocacy, fiscal measures, and regulatory oversight. An example is implementing a comprehensive tobacco-free worksite policy. Health system changes refers to a fundamental shift in the way problems are solved. An example of a systems change is providing employees access to breast cancer, cervical cancer, and colorectal cancer screenings with no out-of-pocket costs. Environmental change strategies involve changing the economic, social, or physical surroundings that affect health outcomes and are best used in combination with other strategies. An example of an environmental strategy is providing employees an on-site workout room with a variety of equipment and offering classes such as basic yoga or cardio routines. Health equity ensures everyone has an equal opportunity to prevent cancer, find it early, get proper treatment, and follow up after treatment is completed. An example of a health equity strategy is to develop and disseminate culturally and logistical appropriate patient education materials. Organizations are recommended to integrate new systems, new strategies with existing programs such as chronic diseases, prevention, education, and service delivery. When using this plan, consider the following. Review the goals to determine which fit within or may be added to your organization, agency, or group. Identify any new objectives and strategies that may be incorporated within your structure. Set short-term and long-term objectives for annual goals, department goals, and individual actions. Meet with partner organizations and agencies within your region to discuss how collaboratively address, and implement objectives and strategies. Identify data that you currently collect or may need to collect to track progress towards objectives and strategies. On a regular basis, review the data collected with your team. Identify any trends, strengths, or weaknesses to determine if adjustments are needed. The first priority area is prevention, which is stopping cancer before it starts. The goals identified promote healthy living habits among adults and youths, reduce environmental carcinogens, tobacco control, HPV prevention, and genetic counseling. For all priority areas, you will find multiple objectives to help achieve the goals. Strategies are identified after the objectives. The prevention goals, objectives, and strategies are found on pages 14 through 20 in the cancer plan. The screening and early detection goals focus on screening and detecting cancer in its earliest stage when treatment works best. The screening and early detection goals, objectives, and strategies are found on pages 21 through 26 in the cancer plan. The diagnosis, treatment, and survivorship goals focus on increasing quality of life by providing support and services to cancer patients, survivors, and their caregivers to address social, emotional, and financial challenges they may face. Promoting awareness and access to different supports and services includes navigation, ongoing care coordination, genetic counseling, and telehealth or outreach programs. The diagnosis, treatment, and survivorship goals, objectives, and strategies are found on pages 27 through 33 in the cancer plan. In this call to action section on pages 34 through 37, we identify action steps an individual, community organization, schools, employers, healthcare professionals, or policymakers can take to help early detection, the prevention, early detection, treatment, and survivorship of cancer in Illinois. The next section of the cancer plan describes the cancer burden in Illinois, with data on state demographics, cancer incidence, and mortality on pages 38 through 45. We have a detailed data for 6 priority cancers based upon prevention and early detection opportunities. The priority cancers are female breast, cervical, colorectal, lung, prostate, and skin. The priority cancers are found on page 46 through 71. In addition to the priority cancers, risk factors, incidence, and mortality rates are provided on these 13 cancer types that are most common for late-stage diagnosis. The late-stage diagnosed cancers are on pages 72 through 74. We have a separate section for cancer in children, adolescents, and young adults on pages 75 through 81. Data is grouped by ages 0 to 14, 15 to 19, and 20 to 39 years. Information provided includes risk factors, prevention, and early detection, incidence, mortality, and strategies. In this section, we discuss health equity and health disparities. We have a detailed report on our community engagement strategy to understand cancer disparities in Illinois on pages 82 through 101. This section includes information about disparities faced by the rural communities on pages 102 through 107, the LGBTQ communities on pages 108 through 109, and suggested health equity strategies on pages 110 through 111. COVID-19 has had an impact on cancer, and we have a section discussing this on page 114. We conclude the plan with a discussion of our evaluation plan on page 115. The evaluation process will review the progress made with the goals, objectives that are measurable in the short, intermediate, and long terms. The dissemination plan and the various dissemination related materials will also be reviewed and reach. We will review the cancer plan on an annual basis and provide updates on our progress for the objectives. If you have any questions, please feel free to contact the Illinois Comprehensive Cancer Control Program at dph.compcancer@illinois.gov.